Thank you for being here with us today. First of all, wanted to know from you what were the key takeaways for you from the event?
So I think the APAC News Network has put in a interesting event wherein we kind of had a interesting panel wherein we got a lot of ideas around what are the other hospitals doing in the industry at this point of time. There were more of ideas around the security, the patient experience, and how the hospitals are adopting technologies. What are the next gen technologies which are coming into the picture? So I think it was a great event, to meet a lot of fellow participants, fellow panelists, and talk about the latest trends in the industry.
Another question I wanted to ask you is that we are seeing that artificial intelligence is being integrated into health now. So, what are the specific initiatives taken by your hospital in specific for integrating AI?
So I think as entire industry is moving towards the AI and the Gen AI piece. So I think we are also in the journey of doing that. We are work in progress. A lot of a lot of use cases around patient care, patient data, and Gen AI use of that for clinical decision and all that. So I think we are making a lot of strides towards that. And it is still because Gen AI has got a lot of things which are needs to be eliminated as part of the data, and healthcare data is a bit complex data. So it is more of things which are work in progress to see the the results. Yeah.
And apart from the complexity of data, what other challenges do you see in integrating AI into health?
See, it's one obviously data, as I said, it is a complex part. It is also I would say the skill set of people who actually work on the healthcare is a scarcity, because the Gen AI people who are working on, let's say, another different industries and sectors, you find a lot of them there in the market when you try to pick up the talent. Whereas specifically for healthcare, you need to have people coming from a clinical background to understand the clinical data. So that is where we do see a lot of challenges there coming in.
Last question I wanted to ask you is, do you think that artificial intelligence and robotics coming up will be able to bridge the gap of the current workforce deficiency that is there in the healthcare infrastructure right now?
I would say definitely yes. Specifically AI, the way AI has revolutionized, the radiology piece in the in the clinical practice. Obviously, you will not be replacing doctors. You'll be having doctors knowing AI, right? Yeah. So it is I mean, saying that you won't be having doctors is a wrong notion to say that. You'll be having doctors who are AI trained doctors are knowing AI. Similarly, on the workforce side, obviously with the use of AI, yeah, a lot of mundane tasks will get reduced, but a lot of smart tasks will get created. So eventually it's a balance which will strike out. People will be working more towards creating solutions and products which will help more on the patient care and patient intervention. So that's how we see it going to the world.
Thank you so much, sir. Those were wonderful insights. Thank you.